I was yesterday years old when I learned that you can use a cyanokit in refractory hypotension. When we say refractory hypotension, that means someone is really, really sick and their hypotension or their really low blood pressure is not responding to the things that we normally do. We give fluid boluses, we usually start vasopressors like norepinephrine, vasopressin. If you're really desperate, you can also use phenylephrine, epinephrine, and maybe even angiotensin too to bring up that blood pressure, but that still doesn't work. Sometimes if the patient has vasoplegia, that just means that their vasculature is like, it's really like not responding to any of that stuff, then you can give what's called methylene blue. And methylene blue helps the body to not produce nitric oxide, because we know that nitric oxide is a super powerful vasodilator, and oftentimes that's released in our really sick patients. So that methylene blue will prevent the body from releasing that, and then it can't have that vasoplegic effect. However, if your patient has a history of being on an SSRI, they cannot receive methylene blue because it will cause serotonin syndrome. And then you have a whole host of other problems you have to deal with. But in those patients, you can actually reach for cyanokit. Well, its mom calls it hydroxycobalamin, but all of its friends just call it cyanokit. Now, in the emergency department, we're usually only giving this for patients who come in from a house fire, any kind of structure fire where they were in an enclosed space, and they have cyanide toxicity. The problem with cyanide toxicity is that it disallows the mitochondria, powerhouse of the cell, from being able to metabolize oxygen through the Krebs cycle into energy. So we're used to giving that cyanokit, which it looks like that tart cherry juice that my grandma drinks for her sore knees. And did you know it actually turns your patient's urine, their tears, their sweat, any kind of secretions that they're making, it dyes them really dark red. But that's just something that will surprise you. It doesn't really mean anything. Anyway, we give that to these patients and it binds up that cyanide and turns it into something that's totally neutral, and our kidneys are able to just yeet it right on out of the body and they do just fine. Usually our dose with this is giving a 5-gram bolus, and then we can repeat it as needed. But this is pretty rare that we actually have to give it. I'm sure those of you who work at burn centers give it way more often because you see a higher volume of burn patients. But thanks to my new friend, Dr. Chalednik, she was telling me all about this on a super sick patient that she was managing really, really well. But I wanted to ask you, have you guys ever seen somebody use a cyanokit for refractory hypotension in a really sick distributive shock patient?